Hello and welcome to NewsX India A-List, where we bring to you some of the most brilliant and dynamic talents of India. Today we are being joined by Dr. Neema Bisht. She is a dentist by qualification, a pharma professional by experience, a TEDx speaker, and now an entrepreneur. She's also the director and co-founder of Careerin Pharma. She completed her BDS in 2009 with the dream of becoming a successful dentist. But destiny had other plans for her. In 2017, after 6 years in clinical practice, she made a successful transition into the pharma sector. While working in the industry, the COVID-19 pandemic hit, and with many clinics shutting down, this demand sparked the birth of Careerin Pharma. Since its inception in 2019, Dr. Neema has been fully committed to guiding and mentoring doctors, healthcare professionals, and life science graduates in transitioning into pharmaceutical industry. Career Pharma has trained more than 5,000 students globally. Well, in fact, she joins us right here on this show. Doctor, appreciate you being here and speaking with us. Please tell the audience what exactly your company, Careerin Pharma, does.
Thank you. So, Careerin Pharma is a training and education company where we train and guide healthcare professionals, life science graduates on how they can make a career inside pharmaceutical industry through our placement and training assistance. And I take pride in saying that till date we have guided and trained more than 100,000 healthcare professionals and doctors across the globe.
Well, that's very interesting. Tell us what made you start this company, Careerin Pharma. What was your motivation?
Yes. So, as you mentioned earlier, I am a dentist. So, being a dentist, I was in my clinical practice, and roughly I practiced around 6 years, and somehow clinical did not work for me. So, at that time I was exploring others career options, and that's how I landed a good job in a pharma MNC in Bangalore. When I joined my job, I saw there my colleagues, they are already were in the same boat like I was, and at the same time many of my college seniors, juniors, they started approaching me, and that's how it started with a small step of Telegram channel. I started guiding doctors and my friends through Telegram channel on weekends along with my job, and eventually it became big, and with our co-founder Harshit Mohan, we started Careerin Pharma with a small idea of giving guidance to other doctors and life science graduates.
Well, I'm surprised to hear that doctors are flocking to this career. What kind of work do they do in pharma companies?
Yes, so being a doctor, many doctors, they think that what they can do in pharma, right? That is a complete corporate job. So yes, inside pharmaceutical industry, see, whatever medicine comes to market, that medicine can't come to market without validation from doctors who are working behind the scenes in pharmaceutical industry. So doctors' approval is very much important in bringing any medicine into market and keeping that medicine into market. Also, I would say, in very simple terms, it is a data driven work. So not a data entry job, to be specifying, it's not a data entry job, but yes, we need a lot of data to do this task. So yes, impact is bigger and impact is more than what you see in clinicals.
But why would doctors join this career when they can do clinical practice, according to you?
Yes, so very good question. Yes, see, clinicals is not everyone's cup of tea, right? A huge investment is required, a lot of patience is required, and very important, that is an irony also, we doctors treating patients for stress, anxiety, but our own work life balance is screwed in clinicals. But when you work inside pharma industry, you get a good work life balance, good salary, flexibility is there, weekends are off, especially for women. You can get paid maternity leaves, you can get flexible working hours. So considering all these factors, yes, doctors can work very well inside pharma industry.
Very interesting to know that. Is there scope for other degree holders also who are non-doctors in this industry?
Yes, absolutely. So one small example, see, doctors, any hospital doesn't mean just doctors. We have nurses there, we have medical billers, coders, remaining staffs are there, right? Similarly, inside pharmaceutical industry, apart from doctors, there are various job profiles for other life science graduates as well.
Well, do you think that this is the next booming industry after IT?
Absolutely. For doctors, I would say pharma industry is an IT industry for doctors. And you know, right, government is also doing a lot of investment in this sector, and India is already a big leader in generic medicine manufacturing. And yes, you know, so many things are coming up. So yeah, it's one of the booming and evergreen industry, especially for doctors.
Right, that's wonderful to know. Do you have any advice for people looking to make a career in this industry? That's our last question.
Yes. So yeah, I would like to say a quote which says that you can't change your beginnings, but you can always change your endings. So always ready to take action and don't lose hope, and especially don't run away from technology and laptop, because we all know there is always a growth behind your comfort zone. So always look for that discomfort which can give you a growth.
Dr. Neema Bisht, thank you so much. Pleasure having you, and inspirational to hear your story and background. Thank you so much.
Thank you.